Good morning, and thank you for joining us for our weekly update. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health, Nancy McDonald-Duncan, our Assistant Fire Chief, and Sam Rogers, our Director of Enforcement. Before I give my COVID update, I just want to say a few words about Pride Month. This is such an important time for so many people who are celebrating the self-acceptance, achievements, legal rights, and pride of the LGBTQ2S+ community. I was honored to raise the Pride flag earlier this week at City Hall and host an amazing virtual event with some incredible local talent. I'm so proud to be the mayor of one of the most welcoming, inclusive, and diverse cities in the world. And here we celebrate our differences. That's why I was so appalled and saddened that last week a pride flag was burned by students and posted to social media. This is not what Mississauga stands for, and I condemn this act in the strongest possible terms. This is an act of hate. It's also unacceptable. I'm relieved that Peel Police are investigating the incident and that the Peel District School Board has also condemned this act. And I'm sincerely sorry for any pain that this has caused any members of the community. This incident hits very close to home for me, as I'm a very proud PFLAG parent with a son who's gay. I can only imagine the hurt and concern an act like this would cause families with LGBTQI2S+ children. Exploring and understanding sexual orientation, gender identity, and gender expressions can be a very difficult and complex journey. And it deeply pains me to think that an act like this has the potential to intimidate people from being open to whom they truly are, and lead to lasting effects on people's mental health and well-being. But I want to be very clear to all LGBTQI2S+ community members and families. As your mayor, I will always stand up and defend you. You have my love and full support. You are an important part of this city. You also have my word that along with my members of council and city staff, I will continue to do everything I can to build a city that is as inclusive and accessible as it is diverse. Love is love and will always win over hate and discrimination. So on to COVID things. Mississauga, things have not looked brighter in a very long time in our fight against COVID-19. Our case counts continue their rapid decline. This week, Peel Region is averaging 37 cases per 100,000, and that's down from 61 last week. Mississauga is averaging 34 cases per 100,000, and that's down from 58 last week. These are the lowest numbers we have seen since last September. The situation at our hospitals continues to improve each and every single day. Trillium now has 20 COVID-positive patients, 5 in the ICU, and another 47 suspected cases. That's the lowest number of COVID inpatients at the hospital since November. The situation is similar at William Osler Hospital in Brampton with 30 COVID hospitalizations, 11 patients in the ICU, and another 28 suspected cases. I recently spoke with the leadership team at Trillium, and I'm very happy to report that surgical capacity is beginning to ramp up, meaning that the hospital will soon be offering elective surgeries once again. And they hope to be back up to 100% surgical capacity by September. And the reality is that we've only made these huge strides because of all the hard work that each and every one of you have put in. Yes, following public health advice has been critical, but it's also been the huge uptake in vaccines that has gotten us to this point. We have now administered at least one dose of the vaccine to more than 75% of all residents 18+ in Peel. Canada is now leading the world's larger nations in the percentages of first doses delivered to adults at 65%. And we are now making headway on second doses, with about 15% of Peel residents 18 plus having received 2 doses being fully vaccinated. I want to thank the Ontario government for opening up second dose eligibility to more residents in Delta variant hotspots, including Peel, and for shortening the second dose interval from 12 weeks to 8 weeks for people who received the AstraZeneca vaccine as their first dose. This was the fair and equitable and right thing to do. So many people across our province stepped up to get the AstraZeneca vaccine as their first dose, and it truly did help curb the third wave. Our top infectious disease experts had been saying that Ontario needed to follow the lead of other provinces and shorten second dose intervals to 8 weeks. Along with Brampton Mayor Patrick Bown and I, we wrote to the province urging them to do this, and I want to thank them for listening. This past Monday, we saw thousands and thousands of Peel residents book second doses when they became eligible, and I thank everyone who did so. But I'm also very aware that so many people tried to book a second dose in Peel and were unable to, or were given an option to book an appointment in another region, sometimes as far as an hour or an hour and a half away. My office has been inundated with calls and emails from residents asking why they can't get an appointment now that they are eligible. I first want to say that I understand your frustration, and I'm frustrated along with you. But here's what I ask of you. Please keep trying to book that appointment. Peel Public Health is continuing to add more capacity to our clinics after having to ramp down over the last couple of weeks when we saw less of the vaccine coming into Peel. And Dr. Lowe has told me that more appointments are being added each and every day. The truth is, while vaccine supplies have improved since the start of our campaign, inventory is still not quite enough to support the rapid push towards the 2-dose coverage. But here's the good news. Canada is expecting a massive shipment of Moderna, 9.5 million doses in the coming days, which means that more appointments in Peel will become available next week. I know a lot of people received Pfizer or AstraZeneca as their first dose, and Dr. Lowe has assured me that it is completely safe to book Moderna as your second dose. Pfizer and Moderna are both mRNA vaccines, and they are biologically identical in their mechanisms and thus interchangeable. So please, don't hesitate to book a second vaccination with Moderna once more appointments become available. I thank everyone for their patience and for their desire to get vaccinated. I want to again assure everyone that more and more appointments will become available in the coming days, so keep trying to make that appointment and book. All of the progress that we've made has finally allowed us to see some limited reopenings. And I was absolutely thrilled to see people enjoying themselves on outdoor patios this weekend, where the risk of transmission was very low. On Friday, my mother, Veronica, and I celebrated getting our second doses by having lunch on Cucullin's patio in Streetsville. And later that weekend, I enjoyed a drink at Shore in Port Credit and even enjoyed brunch at Bobby's Hideaway in Port Credit on Sunday. It felt so great to be able to do that, and I could see the joy on many people's faces that were also out having a great time. We needed this, but more importantly, our small business owners needed this. I can only imagine how much of a relief it was for our restaurant owners to be able to finally open up for in-person patio dining. I encourage everyone in Mississauga, if they can, to please go out, grab a bite to eat, or get a drink this weekend on one of our fabulous patios. Or go out and shop at one of our local retailers. Our small businesses need our support. I'm also very cognizant of some businesses continuing to be severely impacted, even in step one of the province's roadmap to reopen. I know that fitness, dance, martial arts studios are now able to open for outdoor classes, but many don't have outdoor space to do this. That's why here at the City, we are now offering space in our parks for commercial fitness providers and dance and martial arts studios to run their classes. To book a permit in one of our parks to run an outdoor class, please call our customer service center at 905-615-4100. I want to make it very clear that I firmly support Ontario's cautious reopening plan. I don't want to rush too quickly, especially with the Delta variant in our midst. At this point, we simply can't afford to risk the gains that we have made. I am, however, supportive of the province in consultation with our medical officers of health and guidance from the science table, giving serious consideration to opening personal care providers earlier than July 2nd if the conditions continue to be favorable and improve. These are our hair and nail salons, our barbershops, estheticians, and tattoo parlors. Personal care providers have been fully closed since November 23rd and face restrictions even prior to that. And while during the lockdown, other businesses were still able to do curbside pickup and delivery, there was no options for these businesses. We also know that many of these businesses are owned and operated by women who are often supporting their entire families on their own. So I ask the province, in conjunction with medical officers of health, to consider reopening these businesses as soon as possible with the appropriate safety measures in place. Before I bring up Dr. Lowe, I just want to remind everyone that we are seeing more of our city's facilities opening this weekend. Starting on Saturday, all of our city-run pools will be open and residents can book a spot up to 5 days in advance by visiting activemississauga.ca. Outdoor programs like instructional golf, tennis, and fitness will also begin on Saturday, and residents can visit activemississauga.ca to register. Permits for our outdoor sports fields and picnics for up to 10 people can be booked by calling our customer care service center at 905-615-4100. Mississauga, we have a bright summer ahead of us, but please continue listening to the advice of public health. Keep trying to book your second dose appointment as more vaccines arrive and more appointments open up online each and every day. So thank you for all of your patience and all of your hard work. And now, I'd like to invite up Dr. Lawrence Lowe for his update.
Thank you, Madam Mayor, and good morning. Mississauga's weekly incidence rate for COVID-19 sits at 33.9 cases per 100,000 with a test positivity of 3.6% in the past week. Our hospitalizations are improving, and with a surpassing 75% first dose coverage in our adult population, I'd like to take this moment to remind everybody about our game plan for the next few weeks. It's really quite simple. Keep COVID down and get two-dose vaccine coverage up. We know that the Delta variant is increasing in proportion, and that means that our first dose coverage may be rendered slightly less effective. Surges in the Delta variant have resulted in delays to the United Kingdom's plans to fully reopen. As we see more Delta activity, I ask all of our residents to emerge gradually into step one. As society gradually reopens, our lives should also gradually reopen. Like everything else in life, overdoing it or forcing the issue will only lead to disappointment. The science table's updated models, while they are promising, relies on a low transmission scenario to keep our reopening on track. So sure, we can start to reconnect, but please do so in small groups outdoors, and ideally with distancing and masking as much and where possible. No big gatherings, no packed in-person social calendars, just yet. This will hopefully keep transmission down, which will keep case numbers down. And that means that Delta can continue to grow in proportion, but we can keep it in check. 70% Delta of 1,000 cases is very different from 70% Delta of 20 cases. So let's continue to remain sensible in our in-person interactions and keep risk and rates low. And that speaks to my second message, the second part of our strategy. We need to get to broad 2-dose coverage as quickly as possible. Fortunately, we are already at 75%, over 75% first dose covered in the Peel community of 18+. And that is an asset and testimony to our community's collective will to move forward and leave the acute phase of the pandemic behind. Thank you. If you haven't gotten your first dose yet, please get it now. Speak to your family and friends about their own vaccination needs. Check peelregion.ca/COVID-19 vaccine for answers to common questions. And know that staff at our fixed clinics, our hospital clinics, and at mobile and community outreach clinics throughout our region are ready to support you in making the right decision to protect your family, friends, community, and yourself. If you've already had your first dose, please get your second dose as soon as you're eligible. For your second dose, you can get either the same product you got for your first dose or any mRNA vaccine. Our clinics will be offering Moderna or Pfizer in the weeks to come, and I got Moderna for my second dose, but would have happily taken either product that was offered to me. The data is clear that the vaccines are safe and effective, and that both Moderna and Pfizer are essentially bioequivalent in their mechanisms and therefore interchangeable. So if you got either one of those as your first dose, you can get either one of those as your second dose. If you got AZ, you can get another dose of AZ or an mRNA vaccine, either one. The point is that we don't have time to be picky right now. Our goal is to get any second dose available as quickly as possible. It's that simple, and mRNA is mRNA. Get any second dose you can, and let's get ahead of Delta. I want to also take this opportunity to thank our residents as well for their patience. We're very grateful that there's so much demand for appointments and willingness to get vaccinated in our community. Our capacity and inventory continues to grow, and new appointments are being released all the time. Continue to check back, please, if you weren't able to book earlier this week. Keep contact low and transmission down, get our second doses and drive vaccine completion rates up, and that's how we'll finally get out of this thing. Thank you, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Lowe, as always. Before I take questions from the media, I just want to give you a quick update on an item that we passed at Council yesterday. We've been hearing from so many of our residents as well as city staff on how bad the gypsy moth problem is right now in Mississauga. Gypsy moth caterpillars eat leaves from trees during the spring and early summer, and they are a serious threat to our tree canopy. So yesterday I was delighted that Council approved aerial spraying for early 2022 in communities that are most affected by the gypsy moth, which will get rid of the insect and it's at its caterpillar stage. I want to thank Councillor Karen Rast for bringing this motion forward. We have to do everything we can to protect the tree canopy here in Mississauga. So now, along with Dr. Lowe, Deputy Chief Nancy McDonald-Duncan, and Sam Rogers, our Director of Enforcement, we're happy to take questions from the media.
Your first question comes from Steve Picard at Mississauga. Go ahead, Steve.
Hi, Dr. Lowe. First question for you.
Sure, no problem. Here he comes.
Hi, Steve. Go ahead with your question.
And the question is, we all know that people are ready to rip off their masks and run through the malls of Mississauga, but you want people to wear masks until the end of September. Explain why that is so important.
Hi, Steve. I think it's really important to highlight that we still have high first dose coverage and growing second dose coverage. We do have the Delta variant in our community, and as you heard in my remarks, the goal is to try to keep transmission low while we get to broad second dose coverage. It's not a firm date necessarily in September. That's just because with any bylaw, you need to put a date at which point it will be revisited, and certainly will be continued to be revisited based on trends. But I think it's all in our hands as long as we continue to ensure that we are doing our part, wearing well-fitted masks, making sure that we are gradually reopening our lives and all getting second doses. I think certainly the future looks bright. Thanks for the question.
Thank you. The next question is for the mayor.
Yep, I'm here. Thank you.
For the second time, the city of Mississauga councillors have denied cannabis shops to open in Mississauga.
Yep.
Do you think this is a dead issue now until maybe after the next election?
Possibly, but yesterday we actually passed a motion which asked the province to allow us to conduct a pilot, which does give us some control over zoning and concentration of locations of cannabis stores. So if the province were to approve Mississauga as a pilot project, which will allow us zoning flexibility so that we can be sure that retail cannabis stores won't be located near sensitive use, such as daycares, community centers, drop-in centers, not only schools, etc., and that they won't be allowed in a great number or great concentration in one specific area, then we would be open to allowing them, yes. But quite rightly, if the province does not allow us that option, then probably would wait till after the next election, correct?
Your next question comes from Isaac Callan at the Pointer. Go ahead, Isaac.
Great. My question's for Dr. Lowe as well, please.
Yes. Good morning, Isaac.
Good morning.
Go ahead, Isaac.
Hey, Dr. Lowe. So Mayor Crombie mentioned the expanded eligibility in Delta hotspots, but I'm a little unclear just in terms of how this comes with matched supply. So a spokesperson for the Ministry of Health told me that the province is working with public health units to fully utilise their vaccine inventory and then provide additional supply to Delta hotspots. So could you just tell me, what is the state of the vaccine inventory in Peel region? And will Peel be getting additional doses to match its Delta hotspot status, or will it just be the normal supplies you were expecting?
So we increased our vaccine supply, vaccine capacity, delivery capacity again, Isaac, and we had to do this for the second time because we ramped it up once in May for the hotspot strategy, and then we were directed to ramp that down in the end of May. We've since managed to ramp that up again and are using all available inventory and planned allocations, and we have made a request to the ministry for additional allocation through the Delta hotspot program. Thanks for the question. Is the next one for...
Yeah, keep you there, Dr. Lowe.
Okay.
In terms of before this ramp up is complete, is it helpful for the eligibility to be expanded as much as it is, or is expanding the eligibility before you finish expanding the doses perhaps a little problematic for your rollout?
Well, Isaac, I mean, I think it's a bit of a double-edged sword, right? It does give us a lot of flexibility on our end to basically just ensure that we get as much inventory and allocation as possible and build out as much capacity both in our mass clinics as well as our mobile clinics as quickly as possible. But we do know certainly that it can cause frustration for our residents if they're not able to get an appointment immediately when they become eligible. And that's why we're really urging patience. You know, the reality is we have almost 600,000, over 600,000 people that are now eligible for their second dose here in Peel with a capacity of approximately 150,000 doses a week. So it will take some time for us to ensure that that capacity is made eligible. However, that said, as Mayor Crombie has identified, there are more vaccines that are coming to Canada. There's a significant shipment of Moderna that's anticipated over the next week and a half. We anticipate that there will be additional vaccination supplies that come from that. And of course, while our capacity is now built out largely back to the 150,000 a week that we were doing in May, we're not stopping there. We're going to continue to ensure that there are community offerings, workplace clinics again, clinics out in places of work, many of the same places that we went to in the first go-around. And the hope would be that there will be continuing growing allocation that will support those efforts in our region. Thanks so much for the question.
Next question, please.
Your next question comes from Khalid Salama at My Second Home TV. Go ahead, Khalid.
Good morning, Mayor. How are you?
Good morning, Khalid. Welcome.
Thank you. Scoop and poop in our city is failing us a big time right now, and I have taken many pictures for poop left on sidewalks and public and private lawns. That's in addition also to the vehicles blocking sidewalks that forced already pedestrians and those who are on wheelchair to use the street as an alternative. What can we do to address this?
So, Khaled, I'm afraid you weren't coming in very clearly. I'm not sure what the question was. Were there cars blocking driveways and streets?
Yes, and poop as well on the sidewalks and private lawns, as well as public lawns.
Right. So, of course, we have minimum standards that we're required to keep here in the city of Mississauga, and I encourage all residents to call 311 if there's a problem. I, for instance, received a message this morning from a resident on social media about the state of some of our portable facilities at some of our picnic areas, and of course I got staff right on it immediately, but I always encourage people to call 311. It's the best way to get the attention of our staff. And with respect to vehicles blocking driveways, again, call 311 and bylaw enforcement will come out, or Peel Regional Police come out. Sam, do you want to talk about this item? No, he's fine. So, yeah, we can always get to the attention of bylaw enforcement if you call 311.
Thank you so much. And may I ask Dr. Lowe?
Absolutely.
About... Sure, thank you.
Yeah, go ahead, Khaled.
Dr. Lowe, is there any formula for the new herd immunity? Before you mentioned already we have to reach 75% first dose plus, I believe, 20% second. Is that changes with the new variant?
So to be clear, herd immunity actually speaks to a threshold where enough people in the population are rendered immune to a disease where it can't spread any further, where you essentially interrupt transmission. That usually comes with high two-dose coverage. The 75%, 20% is one of the three phases of the reopening, and it corresponds, I believe, there's 70% and 20%, which corresponds to step 2 in the province's reopening framework, and that's the next sort of milestone that they're trying to aim for in terms of immunizations, but also in terms of the broader health system indicators that are there. It is very clear, however, that with the variants of concern, and especially the Delta variant that's in our community, which is more transmissible, and it has always been a truism that while those have been, goals or targets, our real goal really should be to try to get as many people vaccinated as possible. So we do really encourage people, if you haven't had your first dose yet, we are still doing the hard work of trying to get to the last 25% of people who may not yet have been vaccinated, because we do know that many of the people who did get hospitalized, who did succumb to the Delta variant in the UK, those are individuals who have not yet received vaccines. And so I think it's vital for us to continue getting to that last 25% on first dose, and then of course driving up second doses now to match the 75% first dose coverage we have here, and then hopefully push beyond, because the higher it goes, the less opportunity the virus will find a host to be able to infect. Thanks so much for the question.
Dr. Lowe, the next question is for you that I'm going to read as Pooja Luther from Y Media has had trouble logging in. The first question is, why is Osler opening up a COVID-19 vaccination clinic for medically complex kids only?
So thanks so much for the question. I think the youth hub that you're describing really reflects in general, our approach, right? You need to be able to have mass vaccination clinics throughout the community that support the broader population. But we do recognize that there are certain populations that have different barriers to access, whether it be due to their medical status or due to, ethnocultural considerations, socioeconomic considerations. So we have always had clinics that are open to the public, and those are, by far and large, our biggest and our highest volume clinics. And then you do have certain efforts. Certainly, we had the clinic that focused on serving Black, African, and Caribbean communities. We've had clinics that have focused on serving different faith groups in our community, particularly where faith traditions may preclude them from attending a mass clinic. And certainly, Osler has taken their initiative as a hospital, seeing medically complex youth, in incorporating that into their vaccination program.
Follow up for you as well. how many Peel residents are fully vaccinated, and could you please categorize it according to age?
So at this point in time, 15% of our population is fully vaccinated with 2 doses. That number obviously continues to increase. And of course, at this time, the vast majority of those have been people who are aged over 70, as that was the first group that opened for eligibility. But we are now starting to see increasing second dose coverage throughout all age groups as we now move into the first in, first out aspect of the province's second dose strategy. Thanks for the question.
Next question, please.
That's all the questions for today, Mayor Crombie.
Thank you. Thank you for joining us.